The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.
Hi there, and welcome to Healthcare Hour with Colleen Qvist. Another show, another week. I hope that you're all doing really well, and thanks for all your input in the last week. I do appreciate hearing from you. As you know, Healthcare Hour is all about healthcare professionals. It's about us understanding that healthcare professionals are actually people. They have families, they get tired, they get hungry, and they also would like quality of life. They would like balance and to be able to integrate their work and home. We also need to know that as healthcare professionals, how do we improve the relationship between the healthcare professional and the patient, and of course, the patient's family. And also, as the public who are listening to us now, we also need to understand that there are lots of frustrating things from a hospital point of view, but how do we find solutions? How do we work together? It's also about us educating ourselves so that we're not just ignorant, that we can make informed choices. So after the break, I'm going to introduce you to my guest today. I nearly said client. It depends on whether I'm wearing a sales hat or a radio hat. But yes, we're going to meet my guest after the break. Let's go for that break.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. My guest today is Ms. Vicentia Rambau, and she is the Quality Assurance Manager at Tambo Memorial Hospital. So, hi, Vicentia. Thank you for joining us.
Good afternoon, Colleen. Thank you for having me.
Awesome that you've come to join us. So, Vicentia, tell us more about yourself and how did you get into quality assurance?
Colleen, I'm a professional nurse. I've studied a bachelor in nursing with the University of the North. After completing the course, I've joined one of the facilities in the East Rand. I worked as a professional nurse, and I became interested in quality assurance in a healthcare with the aim to continuous improving health services in our facilities. During my stay in that facility, I started becoming more interested in assisting quality assurance office by volunteering, and eventually I got a post in a different hospital under quality assurance. So that's where I get into the quality assurance department.
Okay.
Thank you.
All right. And so obviously quality is important for us in healthcare, but you know, your job as assurance, it's checking, it's the checks and balances to make sure that there is quality. And that there's quality every day, and there's quality in all different departments. Yes.
That's correct.
Okay. All right. So when we look at what happens in a hospital, what would you say are the most common complaints received you know, and also we recently had a media engagement session, and it certainly was shown the different complaints. So I'm seeing it's about, like, it's out there, it's documented. So could you share with us what those common complaints are?
Okay, the most common complaints that we received here at Tambo Memorial is the long waiting list for procedures like surgeries, mostly for surgical patient, orthopedic patient, or eye problem patient. That is due to the backlogs, since you know that we had a problem with COVID. So since then, we are having a very long list for our patients that are requiring the surgery. But there is an initiative that was introduced by the Department of Health, where they have introduced a surgical marathon campaign, where doctors volunteers to try and assist with operating to those patients. Another complaint is the long queues or long waiting times. As you know, we are a regional hospital, level 2, and we received more patients that are coming from the district level. As we are the hospital of choice, we received more patients that are coming from outside our catchment areas. So for that reasons, we end up having more patients, and there are those patients who will be coming without appointment. We have to squeeze them in between those patients that are pre-booked. So those are the most complaints that we received on a daily basis. Thank you.
All right. And then do you find also that people complain about specific healthcare professionals?
Yes, they do. In case that happened, we follow the complaints procedure, where we start investigating by establishing who is the professional and interview them, and then establish what actually transpired. And then we manage or resolve the complaints through addressing or redressing the complainant, and also to try and see if we can intervene by improving the shortfalls that we will identify during our investigation. And then the particular employee or personnel will be dealt with based on the labor relation system that we're having in our facility.
Okay. All right. So I know that let's talk about complaints. Okay. So obviously in South Africa, we've got the right to complain.
Yes.
Okay. We are allowed to complain and say, oh, this didn't meet our standards. This isn't like that. I find sometimes people complain without understanding the system and how things work. Yeah. So what would the complaints procedure be at Tambo Memorial? And is the complaints procedure the same in every government hospital?
Okay, yes, it is. As healthcare facility, we are guided by the guideline on management of complaints, which is applicable to all healthcare facilities within our province. We do have the complaints management system even here at Tambo, where we allow patients, their family members, to raise concern or complain if they are dissatisfied with our service. They can lodge a complaint by coming through to our department, fill in the form, or calling us or emailing the complaint. We also have complaints boxes that are situated in every area. Those that wish to complain anonymously, we give them that platform to do so. We try and address those complaints as soon as we receive them. And we also encouraged patient and family members to reach to the managers of those departments if there are issues or if they are not happy about our services. And we try to avoid to be receiving complaints that are posted on the social media that are coming from the external sources, because should the matter requires urgent attention, then they will be attended. So we are encouraging patient and family members to utilize our system that are in place.
Yes. And so what you're saying is that there is a special system because you have the right to complain. But
There is.
you find a lot of people will probably not do the system. They go straight to social media.
Yes. What we have noted or experienced over the years, people or community opt to go to social media in a sense that they are trying to seek support from the higher level authorities. It's understandable.
Yes.
But it is also important for us to be given a chance to address those issues because it's not nice if you will be receiving a complaint about a patient care that we have been addressing and managing the patient in days, and then when the family comes to visit, they don't raise those issues. They opt to go to social media. So we are having a system in place. We encouraged, we are transparent, we have displayed the complaints procedure posters everywhere. We have been issued the contact details of the relevant people that should be contacted should patient family members wish to raise their concern.
Yes. And so you're also seeing there as well is to not just like have it disappear on social media, to go through the correct channels. And if you don't hear anything, to escalate it, to phone the manager, to follow it up.
That is the procedure that we also encourage them. And we always inform them that should they not receive good intervention, it's within their rights to escalate the complaint. Even with our facility, we are try to address the complaints. If it requires a further referral, we do so. We assist the family or the patients to escalate the matter to our provincial quality assurance directorate for further investigations.
Okay. All right. So on that positive note, let's go for a break.
The Africa Center for Work-Based Learning is a professional development center for professionals who aim to improve their professional standing. This means that the learning programs we run are more than just academic programs. They are work-based programs that focus on leveraging your current experience as a professional to build your overall profile. A year down the line, the Africa Center for Work-Based Learning is developing into a preferred center for professional development in Pretoria, with 8 professional development faculties including accounting, teaching, entrepreneurship, as well as IT and many more. For more information, go to acwbl.org or dial +27 12 751 7608. The Africa Center for Work-Based Learning, where work is learning.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. My guest today is Ms. Vicentia Rambau. She is the Quality Assurance Manager at Tambo Memorial Hospital. And she's been sharing with us that, of course, you have a right to complain, and hospitals do get complaints, and that there is a special complaints procedure. But what they're finding is that most people run off to social media and they put the complaint there with the idea that maybe somebody high up will see it. as opposed to following the process, following the procedure. Vicentia, you also shared with us that there are posters all over the hospital, and that there is a specific process. It is possible to come see the quality assurance department. It's also possible to fill in a form and put it into boxes that are in each department in the hospital. And then, of course, you could also email your complaint.
That's correct.
Yes. So there are lots of different channels and ways of doing things. Yes.
Is
But what you've also said is that it's quite despondent. Yes, if that's, you feel all despondent kind of story when people don't officially lodge a
Utilize.
complaint, they put it in social media. Yes.
Yes.
All right. So let me ask you here then, how is Tambo addressing the complaints that they do receive? You know, those most frequently raised complaints. What is being done? Or is it just, oh, well, they'll complain, we'll just ignore them?
Okay. We do have system in place or initiative that we have or in the progress of implementing with the complaints on delay retrieval of patients' files. We have initiatives that is being commenced. We are utilizing the night shift staff to retrieve the files of those patients that are pre-booked so that when they come, their files will be ready. We also have those patients that report to our facility early in the morning, as early as 5 o'clock. So when they come at 6, then our files are ready, especially those that are coming to collect their repeat medication. So this is one of the initiatives that we have come up with. And we have a pre-booking system where the patients that are booked, then we retrieve their files prior. When they come in, then the files will be ready. And there is a challenge with those patients that are booked. Some, they don't honor the appointment, which also affect our long or our waiting times, because we have to squeeze them in. So, and also we communicate frequently with the patient because now there is a new system that is introduced. We're no longer using the old PAP system to register our patient. This is another issue that we are facing in terms of delaying issuing the patient's files. So we communicate more frequently if there are challenges, if we are having network issues, where we will be now registering patient manual. So we communicate frequently with the patient. Yes. That's how we address. And then if we have complaints that require sitting or address, let's say the patient's file cannot be retrieved and this patient needs to be seen by the doctor. So we open a duplicate or a temporary file for the patient within 30 minutes.
Yes. Okay. So within 30 minutes. So that's
within
also
30
good.
minutes.
Yes.
Yes.
Because I'm just listening to you say, okay, so your night staff pull the files, but obviously for the people that they know are coming the next morning, or
Yes.
also if you arrive unexpectedly, you know, some, as you said, some patients arrive at 5 in the morning. But I assume then, of course, you know, with every pulled file, you've got to put the file back into the system at the end.
Sorry, repeat your question.
I was saying that, you know, you can pull the file for the patient, but also at the end, you've got to put the file back into the system.
That's correct.
Yes.
Especially for those that did not honor their appointment, it is a challenge because we put back the file and then maybe they will come the following day and then we have to try and retrieve those files. Yes. So another issue is those patients that prefer to take their files home. We also encourage them that when you leave the premises, there's a box at the admission department where every file should be placed there when they are done with the consultation or when they have collected their medication or treatment.
So do you find then that people aren't leaving their files behind? They zoom on home with them, and then the next time they don't bring the file with?
Yes, sometimes we do experience that problems.
Okay. All right. And so, it's not just negative. I've seen that Tambo Memorial has been having a lot of positive communication, a lot of people sharing that they have been happy with the service. So would you like to share some of those with us?
Okay. Yes, we have received for the year 2024-2025, we have received 334 compliments from our patients and their family members. Mostly it's on patient care, where they are complimenting the staff on the best service that they have received, and they also recommend the ward that are doing good in terms of providing quality patient care. And we sometimes receive the compliment that are addressed to the specific personnel for the good work, and also to engaged and for good communication with the family members or their patient, as well as being professional. And I don't know if you would like me to read those compliments.
Yes, let's read someone. Let's see who we can make famous today.
Okay. Okay. The first compliment is the appreciation letter. On behalf of the Tokota family, I would like to express our heartfelt and deepest gratitude for your unwavering support and exceptional care of our beloved aunt over the past 3 months. We are particularly grateful for the selfless effort of social worker, Ms. Munama, who went above and beyond to assist us, demonstrating remarkable dedication and compassion. We also extend our sincere appreciation to the medical team, including the doctors and nurses who played a vital role in our aunt's full recovery. Your kindness and expertise have brought immense joy to our family and reuniting us with our aunt after many years. We sing your praises and wish you continued success in touching the lives of other families.
Okay, so that's very beautiful.
Yes.
And they certainly have taken the time to, recognize each person in the whole ecosystem.
Yes, it's true.
Okay. And so we celebrate too that you got your aunt back. Yes. Okay, so I think let's go for another break. And when we come back, we're going to talk about, the referral system, and then also, waiting times. I know people complain a lot about waiting times in casualty departments, but let's go for a break.
How do you know the life of personal coach you're about to work with is who they say they are? How do you know if they can do the job? At the Africa Board for Coaching, Consulting and Coaching Psychology, we can tell you. So, before you share your secrets and spend your money, check with us first. Visit www.abccccp.com or call us on 012-751-7608. The ABCCP, the professional body for coaches.
Welcome back. You're listening to Healthcare Hour with Colleen Qvist. As you know, VUCA Online Radio is an inspiration radio station. We specialize in finding solutions, in highlighting the good, and not just running around complaining and criticizing and not doing anything, not being part of the solution. So we're very much about inspiration to action. My guest today is Ms. Vicentia Rambau. She is the Quality Assurance Manager for Tambo Memorial Hospital, and she's been sharing with us that there is a complaints procedure. You have a right to complain. You have a right to say, I'm not happy. Of course, you also have a right to offer a compliment. And we were just saying that in the 24-25 year, the Tambo Memorial has received 334 compliments. So that's worth celebrating. Yes. All right. So in terms of the referral system, where we know that there's a lot of waiting times. How does this referral system work then?
Okay, Tambo Memorial Hospital is a regional hospital that we cater services. We receive referrals from the community-based services, like the primary healthcare services, the community healthcare centers. We receive a referral from those patients. We receive patients that are being brought by the paramedics and also the self-referral patient. So when the patient comes to our facility, if they're having a referral letter, we receive the patient, we triage the patient will be seen by our emergency department doctor, assess the patient. If the patient's condition requires the patient to be seen in our emergency department, we will continue attending to the patient. If the patient require a primary healthcare services, we refer those patients to our gateway clinic. So we also receive the patients that are coming straight to us without starting at the clinic. Those are the self-referral patients. Since as a healthcare facility, we are not allowed to deny access or to deny treatment, we receive those patients and we also advise or redirect for the patient to go to their nearest clinic by first attending or stabilizing the patient. So we do have the system in place. We triage our patients. We have 4 categories in our emergency department. We have got priority 1 patients. Those are the patients that requires emergency attention. Those patients, they don't wait. When the paramedics picked up the patient, they communicate with us. When the patient arrives with the paramedics, they are waiting for the patient. Immediately they attend to the patient. We have priority 2 patients. Those patients, they wait for, you can say 30 minutes, between 30 minutes and 45 minutes. And we have been within our benchmark in all the priorities patient. The challenge that we are having is those patients that are coming without starting at the clinic, which increase more patients in our emergency department.
Yeah. So I know also, like when you're sitting in the emergency department and you are feeling that, what you're experiencing is a crisis, it's quite hard for you to understand that there might be more people with more of a crisis than you. Yeah.
We have the communication that we are putting in place, like in terms of the posters, there is information that is displayed in the waiting areas where it indicates that if you are tried P1, we also have the color coded. This is how long you are expected to wait.
Yes.
For that, we are trying to reduce complaints on waiting times or inform the community so that they will know when or what, for how long they're expected to wait for service. And we communicate frequently with the patient regarding the delay. Should maybe we have more P1s, or if there is a disaster, then we do that.
Yes. And of course, when people self-refer. You also don't know what's going to walk through the door because, well, a P1 could maybe not walk through the door. But, when a gunshot wound comes in or something, it does become a P1. And so then, unfortunately, everybody else in the queue then gets moved up. Yeah.
It's true, because when the P1 arrives, most of the staff members will be attending to the P1s, and then P2, P3, and then they will have to wait a little bit longer for them to be attended. That also results to delayed or long waiting times in our emergency department.
Yes. So we're seeing from a triage point of view that it's not about, oh, I got here before you. We've got to then evaluate and assess the patient as to say, are you more likely to die if I get assistance first?
Yes, that is the aim of triaging. We say assess the severity of the condition or trauma. We prioritize according to that criteria.
Yes.
Yes.
Okay, so I've noticed for quite a while that Tambo Memorial is actively changing things. They're actively talking about the positive changes. They're actively looking at systems and how to make things better.
Yes, we are in the progress of adopting the ISEF with a smile to address the issue of staff attitude, to also boost the staff morale. We will be launching the initiative soon. So we also have the survey that we conduct annually, is the patient experience of care survey, where we interview patients, their family members on our services in terms of access to care, in terms of waiting times, infection prevention control, cleanliness, and hear their perceptions. And then throughout the years, we have been receiving positive feedback from our patient and their family members. We encourage family members to participate as well.
Okay, so that's very beautiful. It's about, yay, we're going to change things because we obviously see that things weren't optimal. And it's not about, oh, well, let's just live with it. It's like, how do we change it? And so I think, yeah, we also need to recognize everybody at Tambo Memorial who's going out of their way to make sure that every day is a positive yay day in service.
Yes, we are on that. Our communication officer is facilitating that when we receive compliments for the specific staff members, we share the information with the rest of the facility through our social media platform, so that we encourage others to do the same as well.
Yeah. So it's very easy when you work in a big hospital to think that you're just nothing, that you don't matter.
Yes.
But it's
Yes.
also to explain to all staff that, yes, we know that you're tired. We know that you've had to work with so much today. But for every single patient that you treat as if they were the only patient, as if they were the priority one, it makes a massive difference to the community and obviously to the service that Tambo Memorial offers.
It's true. And another thing that I can share with you is that Tambo Memorial Hospital is the facility of choice. As I've said earlier on, that we received more patients that are coming outside of our catchment areas. Patients prefer to come to Tambo because of our reputation, because of their personal preference. During consultation, the doctors will be interviewing patients, and then they will be asking them, where are you from? As far as Fosloras, Sagani, those are the patients that we are seeing at Tambo. So this shows that we are trying as healthcare personnel to provide quality healthcare.
Awesome. So thank you so much for being a guest.
Thank you for having me.
Yes. All right, so you've been hearing from Ms. Vicentia Rambau, who's the Quality Assurance Manager at Tambo Memorial. And I think there's a lot for us to celebrate. Please make sure that if you are going to complain or you're going to give compliments, that you do use the official complaints system or official compliment system. And also understanding as well that as a healthcare professional, wherever you are in this hospital or any other hospital, you are loved, you matter, and you're not alone. And so we thank you that every day you bring the same level of service.
Thank you. We appreciate that.
All right. Okay, so we'll see you all next week. Thanks for joining me and my guest.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What do you say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station. The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What do you say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is Vuga Online, your inspiration radio station.